the skill sets to do that. So each family has a family advocate that has a background in social work. And in this past year, we reimagined the work of that team so that their sole purpose is to engage with families from the beginning of coming into the program to the development of the relationship with the family to intentional conversations around the family and the family needs, the family's hopes, the family's aspirations, both for their children and for themselves. And then building partnerships and setting family goals with them. We adopted the SMART goals model. And in our parent partnership agreements, we use SMART goals to ensure that families are thinking strategically about the things they want to do to improve their lives. One of the tools that we use is a tool that we used when I was in the TA system, which is the scaled family assessment, which some ways models the social determinants of health. And when we are supporting families in the partnership and goal setting process, we use that tool with them to help them identify at this point in time in their lives, what are the things that would hinder their being able to reach a goal that they have set for themselves. And then if they identify that, that would be the thing we work on first with them. And then we also look along that trajectory. What are the things in your life at this point in time that would support your being able to achieve your goals? And if we outnumber if the tool outnumbers support, then we help the family move forward with setting those goals. We've added a component this year to support family literacy because we learned over COVID that a lot of our work with families was virtual, and they were more at ease and more attentive. They didn't have to travel in cars to come to parent meetings and find childcare and be reimbursed for that. And so this did level the playing field for parents to be able to be more participatory in the programs that both supported them and their children. And so this year we're adding a family literacy component coming out of the regulations that require us to support families in understanding they're their child's first teacher, that they have the right to be well engaged in their child's education. And for us, because we are such a multicultural program, we wanted families to feel comfortable in supporting their children's growth and development within their native language. So that if they're reading a story to their child at night, we support and encourage them to read a book that's in your child's language. So when your child gets to speak with grandma and grandpa, they can talk to them in their native language and feel at ease. So that's what we do from a regulatory perspective. Surrounded in that are the services of the Northern Virginia Family Service Agency in and of itself. So 80% of what we do with families initially, because of the income eligibility and often the underemployment, will be transactional. Our families need things, and we support them through the case management process in identifying the resources to meet their needs. And we expect that for a period of time in our engagement with them that we would be doing that. But we also believe that that's just 80% of the engagement. We believe that 10% of the engagement should be transitional, that families should be supported in identifying resources, given the ability to reach those resources themselves as they think about the things that they want to do in their lives to better and stabilize their families. And so our engagement based on our model of case management is to support transitional behaviors for our families. And then we hope for transformational, which is that our families, through our services, through our supports, through our partnership building, and through our working with them in setting their own goals for themselves, that it's transformational when they leave our program, which has a time stop on it, that they are competent enough to function within their communities. They're stabilized enough to be able to be comfortable in engaging in the elementary schools, to be part of the PTA, to feel comfortable in a parent-teacher conference, as well as to be comfortable in seeking different forms of employment if they feel that they're ready to do that. So what we believe is that if we stabilize the home, then we stabilize the child, and then every family will be better off through that process. That's sort of in a nutshell what we do.
Great model. One thing I'm curious to hear more about is
Can
you hear me?
I can hear you now.
Okay. One thing I'm curious to hear more about is that role of your family advocate. You know, we have a lot of names sometimes for this role, a case manager or family support worker. You know, what does the family advocate do that you think makes their role so unique, and how does Head Start support that role?
What that role does is focuses solely on the family, the adults in the household. We don't enroll, that role doesn't enroll children or look for forms that families need to fill out or chase families down around forms. Their entire engagement is with that family. The first thing they do when a family is assigned to them is they have the team created what's called an introductory assessment. It is they start to build a relationship with the family. Tell me about yourself. Tell me about your children. Tell me about your goals. Tell me about the things that you have been frustrated with in life. Help me understand the things that you need and want so that we can start to build a relationship around those things. And then after that, as I said, we have a tool that in the reflective listening part of the conversation, the case manager is identifying on this tool that we call the scaled family assessment, where the family is talking along that trajectory in positive ways and along that trajectory where they are negative. It could be that the family is saying, you know, I've moved 3 times because I'm trying to find stable housing or in housing that I can afford, or I'm living in the basement of a 3-family house, and my child doesn't have it, can't run and play, can't jump, like, you know, from place to place because it's too noisy. So they are reflectively listening to this conversation with the family, and then after that process, in their reflective supervision with me, we go through that to help, and we identify together, where do you want to start with this family in addressing the things that they have identified to you. And then there's a touch point with the family once a week. Sometimes families just say, I'm good, it's okay, we don't need to talk. And sometimes they will call them more than once to check up on something. But at each touchback, the family advocate then starts the conversation around the family. The idea of would you like to think about a goal around this when you say you've moved 3 times and you don't have stable housing? Would you like to start to think about how to get stable housing, and what are the things that are necessary to do that? So they take them through a litany of all the things that the family thinks are necessary, and then part of their role is to help identify the things that the family didn't say, like, is there accessible transportation to where you live? Is there a grocery store where you might think you're going to be, or would that be a food desert? All of the things that support not just stable housing, but the health and access to maintain that housing. And then when families go into an agreement with them, then they follow through with that through the life of that agreement. And the most important thing, I think, is that we have every family must have be touched once a week.
And then the kids are also usually seeing somebody in the program every day because
Mhm.
they're with in an early childhood center or home-based childcare program
Right.
where they're also getting that early education
Education.
experience too.
And then the comprehensive care, there is a health coordinator who is responsible for assuring that the family has a medical home, knows how to access that medical home, and that their children and the family, to the best degree, are up to date on what we call the well care checks for the household. We also have a mental health provider that is part of our comprehensive care team, and so we have families have access um, to behavioral support, mental health support, stress support, as part of just our program. It's not an add-on, it is one of the coordinated services that we provide. Nutrition services go hand in hand with dietary needs, height and weights, consultation around feeding and eating habits of children. And then we have someone that's the title is Parent, Family, and Engagement Coordinator, and part of their job is to identify every possible resource in the communities that we serve that would be accessible to our community.
That's huge too, because we see so often the community resources are changing, the individuals are changing. Right now, we're seeing a lot of new benefits, which we'll talk about in a second too, but it's really hard to manage all of that.
Yeah.
And so one other thing that I know that's sort of unique about the families that you serve and the population served by Northern Virginia Family Services is that many are recently immigrant families or non-English speakers.
Yes.
This is a group, of families that we want to make sure is targeted with equitable resources and opportunities. So have there been some successes with the family advocates in helping to support these families? Or are you seeing any additional barriers that need to be addressed?
No, absolutely. Because there's a touch point every week, and because we have a physician whose sole role is to ensure that all of the resources available to families are given to the family advocates. So when they are in conversation with families, they are talking about the new resources that would be available, and also resources that meet their immediate needs. And we were very successful during COVID. We didn't have any families that had destabilization in homes. No one was unhoused. No one was unfed. So it was, and we're across three counties in our ECE program. So we were really, I say we were really blessed with having the comprehensive services that would allow us to support our families through what was could be a very difficult time. We did have a number of families that had exposure and lived through COVID, but they didn't have to worry about being outside or being hungry.
So can you give us a sense too then of that footprint and type of families served by Northern Virginia Family Services, since you all do cover a large area?
Yes, probably our largest population are the Latinx, the Central American families. That's our second largest would probably be West African, and then the Middle East and East African families are the largest of the population. And Head Start requires that the program serves families with people that look like our families. And so in our classrooms, our teachers are pretty much a mirror of the population that we serve. And we do the same in supporting with the family advocate to the best of our ability. Sometimes that's a little harder, but we do work pretty hard in the recruiting process to try to recruit folks who can speak one of the languages that our families speak.
And is that sort of a component you've heard from families that is helpful in building the trust with your
Yeah,
program?
it has really worked well for us. We are blessed in Northern Virginia that there's such a plethora of languages and people with the skill sets to do the work that we want to do. And we are sort of um, we have a great partnership with George Mason. So a lot of our interns come through George Mason, and then they stay on and work in the ECE program, and building that with Marymount in our health services. And so our resource person in connecting us to all of the possible resources in the community has made it really possible for us to as close as possible serve our families, both in the language that's comfortable and the cultural competency of the household. So to understand when there's a gatekeeper and when it's patriarchal, and so we understand and not cross those lines, but help to blend what the family needs are with our understanding of the culture of the family.
That's great. And is that anything that, I know some of the Head Start is unique, some of the parameters are driven by the federal Head Start program and the federal funding that comes with it. Some of it sounds a little bit like, you know, the culture of your organization and the community that you serve. Could you add any thoughts on how it is that you right size the elements of the program, the rules and regulations and the culture of the community to make that work?
Well, part of it is actually embedded in Head Start. If you read the fine regulations in Head Start, it does say that in a classroom, if you have 17 children and 9 of them speak Spanish, then someone either in the classroom or in the building should be fluent in Spanish, so that there's a connection with the users of this service and the people who are providing it. So that was sort of fundamental to what we have to do. And then we are able to access a lot of external services through our agency and the footprint of our agency. And because we are in Northern Virginia, which is such a multicultural melting pot, that's pretty that runs through the veins of all of our programs. Most of our programs reflect the people that we serve in our communities. Most of the staff that work there do that, and so that's been a plus for us to be able to attract staff that want to do this work, and then to be able to have our clients feel comfortable and safe in receiving the services from people that look like them. Yeah.
Thanks, Melinda. I think that helps to give a sense of Head Start and the family support advocates. You know, one thing that I want to use for comparison is that, you know, it's one of the unique things is the Head Start model that we talked about with the family support advocate, the comprehensive services, the family engagement model, is that when you're in a private preschool childcare setting or even a school-based VPI setting, the model doesn't come with all of those bells and whistles, or now I would say they should be sort of baked in best practices. And so that is one thing that I think is different when you're talking about a Head Start program, and the foundation of that program that started more than 50 years ago was including all of those elements. And so we've kind of moved away from that model as we've built out our early childhood system and really focused on the care and what happens in the classroom. So I just keep coming back, particularly during this time of recovering from the pandemic, to go back to Head Start and say, wait, I think these elements are what we need today, right? We need more of that today. So, you know, I'd love to hear more about how the successes of Head Start and where it's working really well. And so even though it's maybe we need to give some new shiny name to it or something to get more attention, because we often do look to some of the newer ideas. And so I do want to bring Robin into the conversation. So I'm going to switch to Robin for a second, and then I'll come back to both of you and some of the recent federal changes. But if any folks have questions or thoughts prompted from the conversation with Melinda, please feel free to put them in the chat and we'll open it up to questions as well. I'm going to bring in Robin because the guaranteed basic income pilots have been something that have been getting recent attention and are kind of a newer idea. Alexandria's is really just getting off the ground right now, so you can tell us a little bit about the initial stages. Richmond has also had a pilot in place for several months. Many of these ideas are came out of the Stockton, California, which started this, and some initial evaluation and studies that were done on these pilots. So there is some initial momentum here. There's also a lot of momentum around similar components of the now expanded child tax credit and expanded early earned income tax credit that have similar components, particularly the monthly allowance component of the child tax credit. So as we think about these policies and sort of their newness and where we have some momentum, I just wanted to also raise that we may call it guaranteed basic income, universal basic income, monthly allowance. There's a lot of similarities here in the overall components, but we know Alexandria is getting a really specific model kicked off, so I want to hear a little bit more about what you all are doing in Alexandria, Robin.
Thank you. I would just like to start off by saying that this is the brainchild and the baby of the Director of Economic Security and Support in Alexandria. That's Lisa Gilbert and her team. Lisa is on vacation and the rest of her team is really steeped in the Afghan efforts at Dulles Airport. So I feel like I'm a little bit pitch hitting for that team, but I am on the planning committee for right now we're calling it guaranteed income pilot. The name could change, as Emily was saying. There are so many different names that people are using, but we are excited, super excited about this because guaranteed income is an effective way to combat the factors that are stifling economic mobility and exacerbating socioeconomic inequality. And it's about giving people choice and the ability to make decisions in their own economic self-interest. And so guaranteed income, by whatever name we call it, supports three core principles for moving forward from poverty to economic mobility, economic success, power and autonomy, and being valued in the community. Alexandria is also a very diverse community. We have its 2021 median household income is $129,000, and which is an 11% increase since 2018. Alexandria's poverty rate has been stagnated since 2013, and the poverty rate then was 8.5%, and in 2019, 8.6%. So the poverty rates haven't changed a great deal, but it still we still see that Alexandrians of color are overrepresented in homelessness and in poverty data and in low-paying jobs. So this is super exciting for us. It's a bold national approach and investment to combat COVID-19 pandemic economic fallout and those who are entrenched in poverty. It's a challenge to the beliefs that we have about people of color in particular, and about people's work ethics, their intelligence, and their capacity, and to show that we trust that the majority of people will do the right thing and make good decisions. And we saw some of this during the early last year when we had the foods and nutrition support, and families were giving cash disbursements to make purchases of their own food and things like that. And so it showed us that this is something that if we change, my daughter likes to say, throw it all up in the air and start new, and which is something Dr. Martin Luther King Jr. espoused in his early years about poverty. What are the answers to poverty? So for us in Alexandria, we are looking at the Stockton model. And we will be making monthly cash payments given directly to individuals, unconditional, with no strings attached or no work requirements. It will be a supplement for existing social safety net programs and services, and it will be utilized for us in Alexandria as an equity tool, which I believe it is across the country of all the other cities. We are part of the governor's project, group of governors who are interested in doing guaranteed basic income or are in some phase of it. So in Alexandria, our pilot is being funded by American Rescue Act funding. We have $3 million appropriated by the city of Alexandria, by city council in July of this year to conduct this pilot. And what we're in now, we're still in the planning phases because Lisa is wanting to be, and we're wanting to be very intentional about how we go about this and what data we collect, and to make sure that we at the end of this 2-year period, we will have enough data to support opportunities for this to be extended even further. So research findings will provide information on the impact of income volatility, its being well-being and current safety programs and policies. And so those are the research areas that we're looking at. We are looking at a couple of universities' research programs to support us in that endeavor. Payments will be made in the amount of $500 per month for 150 households for a period of 24 months. Stockton, I know, did their project for 18 months, and they served, I think, 125 families, and their data is kind of starting to trickle in now. So we have lots of opportunity during our 2 years to find out what their data showed and then have some analysis on that. The cohorts will have access to supportive services that are offered to the general public. Because we said no strings attached, we're not requiring individuals or families to participate in anything that is not broadly open to the general public. So our plan for communicating that is that when we have applicants to apply, they will be on our general webpage. There will be resources that they will have access to, because of course we do want to help support families who may need some additional support in different areas related to economic stability, but we're not making it a requirement for anyone to participate in them. And so we're looking at eligibility in 2 different ways. First of all, we're looking at median income of households. And so when we're talking about a household size, the household size can be 1, 2, 3, 4, or 5. So we debated whether there would be a requirement for there to be children in the home. It's not. We debated whether it needed to be 2 adults in the household. It is not. So it can be a household of 1. A household of 2, 3, 4, or 5. And then we're also looking at the ALICE income criteria. And that gives us a different set of maximum numbers for a single adult, 1 adult, 1 child, 1 adult, 1 child in childcare, 2 adults, or 2 adults and 2 children. So looking at different formulas to capture and not be exclusive of anyone that meets a certain minimum income or maximum income.
Yeah, Robin, I just dropped into the chat a recent presentation that you all did with ACT for Alexandria too, and a recent article from DC about the pilot too. So I know you guys are getting a good amount of attention for all of this work. And in the article, the DCS article also talked a little bit about the buy-in from the community and the city council for this organization. Or for the pilot, can you talk a little bit about how the ideas have been received since you're sort of changing some of the conceptions of how to support families as well?
Well, again, we're still new in the process and still in the planning phase. And it has been met with mixed comments where, there's still that traditional, patriarchal approach to what help looks like. And so we're breaking that for a lot of people. Of course, families, when you talk to families, they're excited about it. We do have, again, a lot of diversity in our community with our, so just general diversity. And so a lot of people in our community are unbanked. A lot of people have distrust of systems. And so whatever we're doing, we're trying to make sure that we're considering those factors that people have the ability to make the choices about how they receive the money and what they do with it after they receive it. Of course, there was conversation about, do we track the spending? Of course, we need some information for data purposes and research purposes. But all indications from other programs that have participated in a project like this or are in it now show that families are spending money on necessities, food, childcare, rent, utilities. So that has been the trend that we've been seeing. So we have the buy-in of our city manager, of course, and our city council is excited about it. And of course, our whole DCHS department is excited about it. And that's kind of how I got involved on the planning committee, because I said, ooh, childcare, how do we get in there? And so Lisa has gone through and got assurances from many of the state funded safety net programs already, and families will not be penalized because they're receiving funds or supports from other programs. The only one that we don't have a firm confirmation, but we're working on it, and I did get word that there may be a positive response for childcare in this way as well. And so that would just make it just even that much better for me, that we can actually include families who are receiving childcare assistance already, and it will not impact their family costs or fees. Of course, Lisa has been working very diligently with a couple of organizations that have Robinson Foundation. Tayanka has been a huge support to giving us some information and helping us set our planning committee and things like that. And then Lisa has been working with several other organizations that have some experience in guaranteed basic income. And so we're trying to get it right and learn as much as we can from as many people as we can.
That's great. Yes. And a shout out to Richmond. I see Kelly's on here from the Richmond Social Services. I'm not sure if she's part of the pilot project in Richmond, but I know the social services and the Office of Community Wealth Building and others are a part of that Richmond City effort. So want folks to also be able to chime in with any questions, since we're doing this live in Zoom. You can, if you feel more comfortable, typing into the chat or taking yourself off mute to ask Melinda or Robin any questions about what they've shared so far. We'll give a second for people to weigh in with any questions.
I would just like to say why people are thinking about it. I was so excited when I saw that program, Robin, and it was on Channel 4 News as well, and it was just so exciting. I thought, yes, we're finally making sense of how we support people in feeling first like they can become self-sufficient, and then building the muscle to do that around not doling out money to them and telling them how they have to spend it. You guys rock.
I like to use the word sexy. This is sexy and it's exciting and invigorating. You know, when you've been in this field as a social worker for 30 something years, and then you hear about this new opportunity, this new way of thinking, it's exciting. I agree, Melinda. Thank you.
And we did get one question here from Jenna, sort of talking back on the old sort of predatory system, the payday lenders and title companies, that have often been in place as ways for people to get that influx of cash. Is there, do you all have many payday lenders still in the community? Have folks mentioned it as a potential alternative to that kind of predatory lending?
Of course, I think that will never go away as long as we have inequity in our systems. People have to get their needs met, and we do hope that this will be something that kind of level sets around that, where people are not spending more of their income to meet their basic needs from the payday lenders and things like that. Of course, we're very close to Maryland and to DC and other parts of Virginia where those practices are more prevalent. But people find ways to get their needs met, and they have to be resourceful.
Yeah, and so it's unfortunate. So those old legacy systems, although Virginia has tried to make it harder to do that type of business, that potentially they exist. One of the other things that we've seen in some of the initial research around the child tax credit too, is that families are using those cash payments to also pay down debts if they have credit card debts or payday loans or other things that it's being used in that way, as well as the food and housing and other things that you mentioned, Robin. So one of the things that we wanted to get included in our discussion is about this changing landscape of benefits for families that have included a lot of new or expanded benefits during the response to the pandemic, the response of the American Rescue Plan, and now on the table for the American Families Plan, American Jobs Plan. We have expanded child care tax credits, expanded earned income tax credits, expanded credits for food security. So there's a lot of new initiatives that are happening on the table at once. And so we want to get folks a sense of how to maximize those benefits for families too. And then sort of how families are able to access some of these different types of new benefits. Have you all, Melinda or Robin, have you all been involved in helping families access the new benefits that are afforded through the American Rescue Plan, and heard any impact from families on trying to navigate this new array of benefits?
We have each family advocate has worked with families. We sent out a lot of information from you guys and did a lot of parent meetings around how to access it. And I think our families have done a great job of getting that. But we've also, and I was going to ask you, Robin, and Kelly, yes, Kelly said she needed to ask me a question, so I won't forget that. One of the things we have been instituting as the family advocate team, as we talk about and talk with families about the influx of dollars that are accessible to them, that we really needed to also have a real focus on just financial literacy. It's not to tell people where to spend their money or how to spend their money, but to understand money and have understand it differently, because it's really hard when you are struggling to make ends meet to have the brain space to think about what would I do if I had for this moment more money than I actually needed, and then look through that, and it's just for that moment. It's not a lifetime. It's just for that actual moment. What we try to support them in doing is starting to think about what does that look like, and how do you build for yourself a plan around your financial literacy. It's understanding how much money is coming into your household, how much money is going out, and that you're in control of that. And so that's been a big part of our support and work with families around both the child tax credits. Anyone who has a Head Start program knows that the state sent last week $300 to every Head Start household. They tried to do every child. I don't think they were successful in that, but they sent it to every household in the state. That's another $300. And that amount is only good through February of 2022, but it's just helping families think about money differently, and hopefully what we hope to do is help people start to build their own family budgets, and then they make those decisions based on what the data is telling them about what they have, because that's transformational for us. Because they're only going to be in our program for a short period of time. And I do want to say we did have some financial success. We had 2 families purchase homes during COVID in our early Head Start programs. So that I believe that support and that constant identifying resources and helping people think through decisions was paid off for our families. I was so excited. That's the first in my ever life that a current Head Start family had made it to the place where they could purchase their own home.
Yeah, for us, getting the word out through just having a strong communication channel so that families are aware of it, and that families can start having conversations about this, because we anticipate that there will be a lot of people who may be distrustful of the program. And so we want to start alleviating all of that now. So we're sending out communications constantly. And also we're just making sure that childcare stays on the forefront of it all. The work that I do in Alexandria is with early childhood. And so we have the Head Start program under us, as well as the Child Care Assistance program. And so making sure that families are aware of all of the new monies that come out, all of the new opportunities that come out. I've just been so proud to say that we live in the state of Virginia right now with all of the flexibilities and policy changes that have been made around supporting early childhood education. And so just really just in a really short period of time, we've seen what can really happen when people start looking at changing mindsets. And I think that's where Virginia is right now, and I'm excited about that. Of course, there is a case management component to childcare subsidy. And so we're in the process of making sure that we're strengthening that capability for our workers. People who have been in this field for a long time doing work the same way. And so we want to make sure that they're coming along as well with the rest of our thoughts and philosophies around supports. And that's going to take time too. But we're just making sure that families are going to have access to the types of case management support that they need to continue to maximize. And we want to see some families buying homes and doing different things. One of the things that we are decided against too in Alexandria is that you don't have to continue to live in Alexandria if you get accepted into this this basic income pilot, because you may have an opportunity to buy a home somewhere else that's less, where the cost of living is less expensive. And so we're really looking at things like that as well.
That's really great. So I'm going to read Sandra's question to make sure I have it correct. And then Kelly, if you want to come off mute to ask your question. Sandra asked about how families who didn't file 2020 taxes might qualify for the tax credit if they have children. So Sandra, I'm going to answer what I think is the answer, and then tell me if I didn't get to your question. Families who filed in 2019 or 2020 are eligible for the child tax credit, even if they haven't officially filed their 2020 taxes yet. If they had a baby in 2021, this current year, that wasn't included, or in 2020 when they filed their taxes, they will need to get onto the IRS portal to add a dependent when that information is available. We've been told that change to the portal is coming in late August. It is now late August. So we don't have that change yet, but hopefully it will be coming soon. Where folks can add that information. We do plan to reach out to a bunch of our partners to help get the word out that when that add dependent or an add baby feature is added to the IRS portal. Yeah, and so then Kelly, so Sandra, let me know if you still have a question there. And Kelly, if you want to ask your question, thanks for being a brave person coming on camera and asking your question.
Problem. And so this was for Melinda, but also in listening to Robin's last answer, also curious for you all. I love the idea of sort of one of your models of practice in terms of 80% transactional practices, Melinda, and then you talked about transitional and transformational. And so I was curious in programs focused on early childhood, but even looking outside of that across your entire organization, and Robin, sort of the same question. What have you found have been successful practices in terms of promoting that sort of split of attention and focus in programs that might be perceived as more transactional in nature, processing, specific metrics, things like that. Just wondering what that looks like in the programs where that might be more easily understood in terms of the outcomes and the goals of the program, and in those that are under the human services umbrella or a part of other, social services organizations that might, where there might be questions of, is there time for that? How does that blend it so everybody's a part of that vision?
Well, I'll go first. It's our agency has a big focus on case management. And so, and as an example, when the COVID hit and lots of counties got the money that funneled from the state through the counties to support like rental relief and other emergency assistance, what we did as an agency was we stood up an emergency response team. And that was it was a twofold team. One was the transactional piece that you bring your information, you need to get rental relief. But in the conversation, we recognize that this is the thing you come for, but there are more things. Then we also set up a dual case management team, so that person could get the rental relief and then connect with a case manager to determine whether or not that there were other services within our agency that family could benefit from at that time. So we do try to do a wraparound in all of our services. We're looking at now placing case management in our Hunger Resource Center.
Thank you.
For us, we're looking at we're wanting to hear the voices of the people. And that's just been extremely important to us since the pandemic hit. And so we're having lots of conversations that are just kind of like happenstance conversations that is giving us lots of information. So someone may call in for one thing, but then you hear their story and you start connecting them to other things. So we're looking at case management happening at all points of entry in our DCHS systems. And it has to be that way because people shouldn't have to tell their story 15 million times to get, a service that they need. And so that's the way I'm approaching it with our early childhood services, is that whatever call you receive, let's pass that on. We do have a new coordinator position that is in our Kids First Years program, which used to be Smart Beginnings Alexandria. We have a coordinator position, and that's all her entire role is linking families to resources and supports. And so everybody just pouring into her repository of resources.
Thank you.
Those are great examples of how we can work across systems, right? Start from the family focus instead of the system focus. That's often what we see in these issues of family economic security or early childhood. There's so many different systems that aren't aligned trying to work together, but we have one family. So we really need to wrap those services more around the family with that approach. Yes, so Sandra talked a little bit about answered the question that the portal for the child tax credit is not super user friendly. I would agree. And I know that some of you all have been working with families to help navigate these systems. We also are trying to reach out to those who don't typically file taxes, because non-filers are also eligible for the child tax credit, or folks that earn too little to have to file taxes. And so have you all, I know we've shared resources around helping people understand the screenshots of how to use the portal and different languages to access the information, because it's not always available in other languages than English. Have you all, or the case manager or family support workers, advocates, found any particular tips and tricks to help navigate these new systems, new IRS portals, PBT benefits, things like that?
Well, our team goes in, and that's sort of part of the muscle building in case management, is to go into the portals to kind of first identify what the gaps might be, to kind of functionally come up with a workaround for families. We had a number of families who were not tax filers who were actually eligible for the child tax credit, and so that they were typically not comfortable with portals and any of that. And so part of our roles and responsibility was to kind of become familiar with that, so that we could support them in navigating what was a system that they had never used for anything.
We're taking the approach that right now, everything is urgent. If there's an opportunity for a family to receive a service, it's urgent. And thankfully, the state has authorized overtime for staff in childcare services. And I know just this weekend, we had one worker who was helping families navigate the portal. So she came in on a Saturday just for that purpose, to make sure that they could get their applications in time, completed in time for the resources and the benefits that they were applying for. So it's just looking at it from that perspective of, we got to do it now. We don't have 30 days. We don't have, it's now. Everything is urgent if we can link a family to a resource.
That's huge. It's changing the mindset and changing those hoops to jump through too, on both the policies and the practices too. And so, you talked about the urgency and this opportunity we have right now to advocate for these changes, the interest in guaranteed basic income, this idea of the comprehensive services in the early childhood system. And you guys are close to DC, so maybe feel a little bit more pulse of the DC Congress vibe, that right there, this week, the next few weeks, they are weighing in on the $3.5 trillion plan that really includes a lot of our hopes and dreams in it, right? The expanded access to childcare, preschool, and Head Start. It includes the extension of the expanded childcare child tax credit. It includes the paid leave and paid family medical leave. So kind of a lot of the things that we have identified are missing in terms of families' economic security during this time. So I want to give a plug for those who are maybe not even so DC adjacent to weigh in and pay attention to what's happening in Congress, and to talk to your local elected officials, local congressional representatives too, to really understand the urgency around that. We have one of our friends on here from the Campaign for a Family-Friendly Economy. Hi, Christina. I won't make you say anything unless you want to. But right now they advocate for paid leave and access to childcare and things that make the care economy work. And I know for many families right now, the economic stability is a huge part of what factors into feeling secure emotionally and financially as their children are heading back to school. And as we're entering a time of maybe other uncertainties with COVID and school. So we are partnering with the Campaign for a Family-Friendly Economy, many other organizations, to help families tell their stories and tell their stories to congressional representatives and others about why these supports are so needed during this time, so we can hopefully push this 3.5 trillion rescue plan through Congress in the next few weeks. So if you are somebody who is a parent yourself, if you work with families, if you're also feeling some of this uncertainty, we'd love to hear your story. A couple of ways you can do that, and putting a link in to our blog right now. If over the weekend you want to journal and type something up and tell us your story, you can do that through that link. You can reply to me or reply to our team, and we'll set up some time to talk to you and hear about your story. You're potentially a case manager or a home visitor or family advocate who works with a family and want to help tell their story, we'd be happy to connect with all of you to have that support system in place to make sure that we are telling families' story. But this is really an opportunity where we do have some urgency, an urgency to meet families' immediate needs, and an urgency to change the policies and systems that have been in place for so long and have been unjust. So encourage everybody to help make the case and help share your stories here. So we have a couple minutes left. If there are any additional questions or any points about the concept of moving from that survival mode to economic stability and mobility, I want to hear, if there's one thing that you could tell policymakers in Virginia, what do we need to change? What would you wave your magic wand and put money towards first?
Are you asking all of us or anybody?
Anybody can weigh in on that, but Robin and Melinda, if you want to start.
Okay. Well, I like Robin have just been so excited in the way our state has pivoted to recognize the needs of children and families, and not just from the point of view that the economic needs, but just the whole social and emotional aspect of stabilizing homes so that parents can concentrate on parenting and children can concentrate on being children. And so I want to give a shout out. Robin gave a shout out to the child subsidy program within Alexandria. And I just want to give a shout out to the Commonwealth of Virginia in the rethinking of how families can access child care subsidies. It has been a struggle for a number of years for families for reasons that made no sense and clearly only hurt children. So I am really, really glad to be living in a state that I think is leaning into their recognition of the needs of children and families. So I thank everybody on this call that's doing something on that behalf.
I would say to our policymakers our stakeholders at every level, organizations like Voices, keep doing what you're doing because it's moving us in the right direction. My magic wand moment would be that if we can create a system that was broken from day one and contributed to economic and inequality and poverty, we can create a new one. And I can see Virginia leading the way to do that. But when we have a system where there are haves and the have-nots, it's designed to create division and competition and inequity. And so my magic wand would be that every necessity, food, housing, transportation, medical care, and of course, childcare and educational opportunity is available to everyone, and that everyone in the country would have the financial resources that they need to create their self-fulfillment.
That's awesome. We're hoping Robin runs for some policymaker position with that wonderful vision. You're just not in the cards for you. We'll get you on the inside then and keep working on this policies from the inside. So anyway, I'm curious if anybody else has some ideas that they'd like to share from their communities, or ideas of what policymakers need to hear about moving beyond survival and to that stability and mobility. You can put it in the chat or come off mute. Well, as you're thinking, I hope we can all sort of be a part of challenging the status quo in this arena, right? Challenging that we need to have compliance and requirements and hoops for families to jump through before they can achieve stability. Challenging the status quo that a food program has to be separate from a housing program or a child care program, and they can't all work in collaboration. And challenging the program that family supports and child care supports are separate in some way rather than combined. So the mentality here about working together across systems, comprehensively supporting families, is something I'm sure many of you as advocates also believe in, and more folks who are policymakers and elected officials need to hear as well. So any other additional thoughts or comments today? Robin or Melinda, is there anything else that we didn't cover that you wanted to add here?
No, I don't think so. I think that hopefully I want to watch Robin's program, and hopefully that can be replicated so that people have also not the right to self-determination. That what is success for me should not have to be success for the person next door.
Thank you, Melinda. And I just want to reiterate that this is Lisa Gilbert's program. I will not steal another's idea or their brainchild. But you know what? During this pandemic, I have often, and I started a list of, because it just felt so hard to get through this pandemic. I started a list of COVID blessings. And this is truly one of the COVID blessings, that the collaboration that is occurring, not just within Alexandria, but across the region and across the state and across the nation, where we are seeing families and respecting families as humans and individuals with unique and diverse needs, and not separating them into the segments like you were saying, Emily and Melinda, that we're seeing, you know, the pandemic pointed out like nothing else that childcare cannot be separated from anything else. It cannot be separated from employment or housing or anything. And so I love being in childcare right now.
Well, thank you. If you guys will both drop your emails in the chat, if anyone has additional questions to follow up or another part of the state wants to learn more and replicate. I know, Robin, there's a lot of people who are looking at the guaranteed basic income. So I also shared those links earlier. If folks want additional presentations, so your email doesn't get flooded with other questions and additional information. We'll be sharing things as we're connected to both the pilots in Richmond and Alexandria, and hope to lift that up along with our advocacy for the continued child tax credit as well. And so as you're doing that, I just want to say thank you so much for all that you do, not only on our call today, but all that you've done to help support families during this difficult time and make sure that folks in Virginia, the children of Virginia, are getting off on the right foot. So really appreciate all of the time and work and creativity and passion that you bring to this work in your communities. And we're grateful to your time today as well. Thank you.
Thank you.
Thanks to others who joined in on our call. And we have one more event tomorrow, as I mentioned, around a listening session for folks to talk about their mental health experiences. So I'm trying to include that link as well. And we'll make sure that if you haven't participated in any of the other events from Racial Truth and Reconciliation Week, that you can go back and view the archive, the full archive. There's a ton of great information there to dig into as you have time. So thank you so much for everyone joining in on a Friday afternoon. And now TGIF.
All right.
Thank you. Bye. Thank you, guys. Robin,
Thank you
awesome.
for inviting me to the conversation.
I'm so
Appreciate
glad.
it.
I'm so glad. And we'll connect with Lisa too. I'm sure I've been on an email chain with her too. But I'd love to connect with her too.
I dropped her email in the chat.
Awesome. We're talking to some of the Richmond evaluators in a couple weeks too. So I'll see if your evaluators are connected.
Oh, yes.
From the Richmond Fed is doing the Richmond evaluation too.
Yeah.
Okay.
Awesome. Okay.
Awesome.
Thank
Thanks.
you. Bye-bye.
Bye.